What if we asked ChatGPT what are the best dry eye treatments? My name's Dr. Leigh Plowman, Optometrist, and I've got a keen interest in dry eyes. So I wanted to go through with you today, what would ChatGPT recommend for dry eyes? So I asked ChatGPT, what are the 12 best dry eye treatments that are available? So here's what I asked ChatGPT, what are the 12 best dry eye treatments? And ChatGPT responded, and overall I was pretty pleased with what ChatGPT says. And it said the best treatment for dry eyes often depends on the underlying cause and severity of the condition. And of course, I fully agree with that. It's great how ChatGPT mentioned that from the first paragraph. The better that we can understand causes, the better that we can treat dry eyes. So it's really important. For me, it's one of the things that I love to do. I love being able to show my patients photos of their eyes and explain them and really help them to understand this is how my eyes are, what the changes are that I'm seeing. And then it really helps people to connect and really get behind the treatments as well. So the number one thing that ChatGPT suggested is artificial tears, particularly adding moisture to the eyes. And I think this is good. It's a helpful first step. So particularly dry eyes often causes more evaporation or less tears to protect the eyes. And it's a little bit like having a wetsuit that is nice and thick and protective from the environment. Dry eyes depletes that level of moisture and it turns into a bit like a business shirt, which doesn't protect you from the cold or the air or even warmth as well. So it's not very protective. So this is a good first step from ChatGPT. If you're looking for some of my top dry eye treatments, have a look at shop.dryeyedirectory.com and you'll be able to search for a variety of eye drops, eyelid cleansers, heat masks, and several other products that I personally use and recommend to my patients. So tap the link under the video below. The second step is prescription drops, it suggests, particularly anti-inflammatory drops to reduce inflammation or tear production. These are great steps. Dry eyes often does cause inflammation. It leads to evaporation of the tears, and then that causes more salt to be left behind. So we get increased saltiness of the tears, and then that aggravates the cells that are on the skin of the eyes, and it makes them more inflamed, and that ultimately leads to dead cells and nerve abnormalities on the eyes. So interrupting the cycle of inflammation is important. It's usually not something that I'd jump straight to. I'd be more looking to try and treat other associated factors first, and before I look to prescribe eye drops. The third treatment that it recommends is warm compresses. And it says that it may help unblock oil glands and improve dry eyes. I like warm compresses. I think they're great, especially for meibomian gland dysfunction. We want to help loosen some of the oils, remove some of the blockages and the debris, and help the oil to flow better from the glands. And doing warm compresses can feel good, nice and comfortable on the eyelids, especially if you have a mask that's open so that you can keep your eyes open and you can keep reading or doing things while you're doing the treatment. And have a look at the link under this video and you'll see some good masks for open eye use. Warm compresses are great for meibomian gland dysfunction, but for ocular rosacea, they can cause the blood vessels to dilate, and the blood vessels in ocular rosacea are often leaky, and that can lead to increased inflammation in the eyes. The fourth treatment, this is one that I love talking about, is lid hygiene. Often the skin around the eyes develops a plaque-like bacteria. So just like we get plaque on our teeth, we can get a build-up around our eyelids. And this plaquey bacterial growth can then can then disrupt the normal moisture layer, the oil layer around the eyes. And it forms soapy material which is irritating to the eyes. And it might be one of the reasons why you can experience a stinging sensation. So I love looking at cleaning the outside of the skin, reducing this bacterial buildup. It's usually something that we can't completely eliminate, but reducing it can make a significant improvement to the comfort of the eyes. And there's a link in the description for some of the lid hygiene products that I recommend. Punctal plugs are the next recommendation from ChatGPT. So this is where the tear ducts are plugged, usually with a collagen or a silicone plug that blocks up the drainage. The thing I don't like about punctal plugs is that it keeps more stagnant tears in the eyes. The tear ducts are there to help flush away bacteria, dust, debris, pollen, and any other junk that's got swept into the eyes. When we block up these tear ducts, it actually promotes inflammation and can potentially make dry eyes worse. So usually I'm not a big fan of punctal plugs. Omega-3 supplements. So ChatGPT recommends these because they reduce inflammation and improve eye moisture. I like a good quality omega-3 supplement. There's often omega-3s that you can get from the supermarket or other stores, but they're very limited in their ability to get absorbed by the gut. And getting a esterified omega-3 can help you to absorb about 30 to 40% more of the omega-3s. And it's been shown that omega-3 helps reduce inflammation in the eyes and can help protect the corneal nerves. It's very easy for the nerves to get inflamed and affected, and the DHA in particular can help protect corneal nerves. So I'd agree that omega-3 supplements are helpful. Humidifiers is the next step recommended by ChatGPT. These help to improve the moisture content of the air around you. For some people, they have a lot of air conditioning, low humidity, particularly in their office or in their home. And this low humidity takes moisture that normally would be close to the eyes or just outside in the air near your eyes, and it wicks that away really quickly. So improving humidity is helpful for dry eyes. Blinking exercises. This is terrific that ChatGPT mentioned this. There's even in the TFOS News 2, which is one of the industry reports, blinking exercises isn't mentioned as part of the standard treatments for dry eyes. And often, surprisingly, my patients are surprised when they hear that often they don't blink fully. And particularly it's worse when we go to read a book or look at a screen or a device. Our eyelids just don't meet together. And if they don't meet together, it means that we're not getting that nice oil layer getting squeezed out of the oil glands and coated across the surface, similar to a paint roller rolling across the wall. So blinking exercises are really helpful, and I'll leave a link under this video to some exercises that I often recommend to my patients. Avoiding irritants is the next step. Avoiding smoke and allergens and airflow, they're all really good environmental tips. And these would be some of the earlier changes that I would look to do for my patients. So we look at dry eye glasses that help protect the sides, not just top and bottom, but also the outer side as well. And this helps prevent dust, allergens, smoke, and airflow from getting into the eyes and irritating them. And also helps keep more of the moisture inside the eyes. So definitely dry eye glasses can help, and I'll leave a link to those in the description below. Lifestyle changes. We need to think about breaking up screen time. How can you break up your day instead of having a solid block of 2 or 3 hours at a time? How can you break it up into, maybe you can break it up into 45-minute segments or half an hour segments. That gives your eyes a chance to have a break, and gives you time to reset mentally as well. And we can also look at improving our diet. Often a Western diet is pro-inflammatory. A lot of the things that we eat affect our gut bacteria negatively, and improving your diet can help improve dry eyes. Medication changes are another great step that ChatGPT recommends. Often the medications that you prescribe for some things, like antihistamines, blood pressure medications, medications for anxiety or depression, these medications can often negatively affect dry eyes. They might even cause not only dry eyes, but also dry mouth, dry skin, and have other side effects. So I'd agree with ChatGPT that it's great if you can talk to your doctor. There might be an alternative medication that you can try, or maybe you can adjust the dosage with your doctor to be able to see if this change can have a positive effect on dry eyes. Surgical options is the last of the 12 tips that ChatGPT recommends. And they talk about punctal occlusion. So this is like a punctal plug, except it's a surgical treatment to permanently close the tear ducts. I'm not a big fan of this. I think it keeps more of the stagnant tears in the eyes and promotes inflammation on the surface of the eyes. Meibomian gland expression, that's a treatment that I would tend to do for my patients, and it's an in-office treatment to help clear some of the blockages in the meibomian glands. I don't think this is a surgical treatment. It's a very minimally invasive treatment, and something that works really well for meibomian gland expression. Amniotic membrane transplantation is not a first step treatment for sure. It can have some anti-inflammatory effects, but it's not something that I would be my go-to treatment. I like at the end of this how ChatGPT says it's important to consult with an eye care professional to determine the underlying cause of your dry eyes and develop a personalised treatment plan. I love how ChatGPT mentions this, and this is what I love to do for my patients, to educate them about the causes for their dry eyes and then explain those causes and develop a personalised treatment plan. So I love this step from ChatGPT. This is great. So then I asked ChatGPT, why did you rank the treatments in this way? Why did you put the particular treatments from 1 to 12? And ChatGPT responded. It said that these are the most commonly recommended treatments for dry eyes, but they're not ranked in any particular order or specific order. So what are some of the things that I think ChatGPT missed for best dry eye treatments? It's becoming harder and harder to find drops that do have preservatives now, but I think that means it's even easier to find drops that are preservative free. Preservatives are put into a bottle of drops to try and keep it longer, so you get to use it for longer without getting any contamination from bacteria. Now with technology for drops, it's becoming a lot easier to get multi-dose drops that are in a bottle and are preservative free. So I think looking for preservative-free drops is going to be a lot easier, and I often recommend preservative-free drops to my patients. And this is one thing that I think ChatGPT missed. Intense pulse light is another treatment that I've had great results with for my patients. So it's a bit like a laser. It's a skin treatment, and we flash bright lights around the skin on the face. The light gets absorbed into the meibomian glands and helps to switch them on. So it's like we're boosting their metabolism up, and it helps them to be more active, producing better oil. The light also helps to get absorbed by blood vessels like ocular rosacea vessels, and this helps those blood vessels to shrink down over time, so they're less leaky and they're less inflammatory. And IPL also has anti-inflammatory effects, and it helps to reduce some of the saltiness, that hyper saltiness of the tear film. It's a drug-free, drop-free treatment, and I find it's terrific for meibomian gland dysfunction and dry eyes. Overall, I feel that ChatGPT did a great job. These are some really good treatments for mild dry eyes, but they're not necessarily treatments that I jump to for moderate to severe dry eyes. So I was really pleased overall with how ChatGPT responded. It's listed some great treatments, and I think there can be some really useful ideas from these artificial intelligence tools. And let me know in the comments below, what's one of your best dry eye treatments that you found works well for your eyes? Everyone's different, everyone's unique as far as their genetics, their background, their environment they work in. But I'm interested to hear, tell me what are some of your favourite dry eye treatments? So if you're looking to make an improvement to your dry eyes, have a look at my doctor recommended products for dry eyes in the link in the description below this video. If you like this video, give it a thumbs up, and I look forward to seeing you in the next video. Thanks.